Okay. My name is Katie Shu. The date is June 17th, 2020. And on behalf of the Asian American Civic Scholars Group in St. Louis, I am interviewing Mr. Yimin Zhu. Mr. Yimin Zhu is on the board of Chinese Culture and Education Services and previously served as principal and chairman of the board of St. Louis Modern Chinese School. He is currently a campaign manager for the United We Are Strong campaign. This interview will focus on the shortage of medical supplies during the COVID-19 pandemic and Mr. Yimin Zhu's remarkable work fundraising to support hospitals and first responders. This is part of the St. Louis Asian Americans in COVID-19 Oral Histories project. So to start off, can you provide some background information about yourself and your involvement in the Chinese community?
Sure. Thank you, Katie. My name is Yimin Zhu, and I start the community service probably about 20-something years ago with our St. Louis Modern Chinese School. And I was a principal for 2 years and the chairman of the board for about 7 years. And then I get involved with the Chinese Culture Days and Chinese Culture and Education Center since 2001, so it's almost 20 years. So we started the Chinese Service Center about 5 years ago, and I forgot and exactly when. So it's basically we've been serving the whole community and also extended the Asian community for some time.
Great. And more specifically, what does your United We Are Strong campaign aim to do?
So the beginning of this campaign, we try to support the healthcare professionals and first responders, and also the seniors who are most vulnerable to the virus. We have been extending our campaign to the low-income community and also some people who really needed those PPEs, and and also we have been doing some helping to donate some lunch and dinners and drinks and helping the local business and also support the first responder and healthcare professionals.
Okay, great. And for the record, how much were you able to raise throughout this campaign?
Through the whole campaign, we were able to raise a little over $140,000.
Wow,
And
congratulations.
yes, that's a quite achievement we received.
Yeah. So do you remember like what time and like during the pandemic and like what exactly inspired you and your organization to begin this project?
Yeah, we actually start at the beginning of the year when the virus spread out in China. So we actually started the campaign to raise money to support the hospitals in Wuhan, China. And then, so when it's actually outbreak United States in the early March, so there was some kind of, I'll say some people kind of really, and there's a couple of things happened to our community. And the ones was our principal went to the local license bureau, and so when the clerk, saw her face, and she started carving, her mouth, and that's kind of, we we never our Asian Americans are not the issue, but we certainly want to be part of the solution. So that's one of the reasons we start this campaign. The other reason we started, so we saw early this year what happened in China, and a lot of medical professionals, and they are, infected by the virus, and we also heard from friends working in the hospital they really need the PPEs because they just not ready for that. So that's what we, made us think, okay, right now the virus started in our home. We need to protect our home. So this is something we need to do. So we started the campaign, and then it was quite successful. A lot of people supported.
Mm-hmm. Did you face any challenges regarding starting the fundraiser?
Uh, we had some concerns, and during the campaign, there are a few incidents actually happened. But in general, we receive a lot of support. Uh, See, like one of the incidents really we know we buy those masks from China, and then some people will have some questions. Why you'll be able to buy those masks and why we can't buy the mask? So there was one organization we donate the mask to, and they put it on a social network. One of her friend comment on this, hey, who's hoarding those masks? I can't find those. And we're not, we're certainly not the people actually hoarding and try to jack the price. And we are the one, we want to be part of the solution. We actually worked really hard in trying to find, find the quality mask and trying to get it shipped to here and trying to send to the people who really need it. So that's the part of the challenge, to find the right resource and to send it to the right people, and also trying to convince people this is something we actually were trying to support our community.